go back to early March 2020, Premier Health as a whole was starting to open their incident command center as a system. So the physicians in the community were looking for an outdoor tent facility where that one location could, quite frankly, be the community swabbing location. And that's what we did in exactly roughly 48 hours.
The initial test site, a gentleman on the faculty at UD saw an article about the first drive-through testing site in the West and sent that to Eric Spina, the president of UD, who sent it to me. And I asked our lab people, he asked his people, how could we figure out how to do this?
We had put together a meeting on Sunday, March 15th at the UD Arena between Premier, Compunet, Fidelity, and UD. So we went live where we saw greater than 300 patients the first day.
And we did it in a way that hadn't been done anywhere in an area before, which was as outpatient, outdoor, mobile location. That took a ton of resources and ingenuity to be able to pull together. And there were people that came from a lot of different backgrounds to make that happen.
I mean, if we had not done that, I'm not sure what we would have had available. It was the community need, and that was a big discussion of ours from the beginning, was this is what's right, this is what needs to happen, because if we don't do it, we're not sure if anyone will. And I think that's been a through line theme from the beginning, is what does the community need?
We are seeing between 1,500 and 2,000 swabs a day. Our instruments, of course, have a limited number that they can do on any given 24-hour period. So we've had a lot of people working a lot of overtime to keep those instruments running 24/7 so that we can get those specimens turned out.
And when COVID started to be quite prevalent in the area, Compunet took it upon themselves to not only to be the experts as the entity that will be the testing company for Southwest Ohio, but they've actually exceeded that. They are the experts in testing for COVID.
So with COVID testing, that has been a 24/7 operation, but there are also so many other tests that we do to take care of our community for people who, have standing orders for blood work, to make sure that they're staying on track with their medications. So we are seeing a very large volume every day of tests that are not just COVID. I mean, everybody thinks about COVID and with lab, that's all they think about. But there are a lot of other things that we're testing for and maintaining all of that as well, 24/7.
I think the biggest component was getting that collection site up and running at the beginning, because it was so adaptable. And that's really something that I have been involved in each of the collection sites that has opened up since then.
They have had to stand up multiple businesses in the course of 9 months. They spent extraordinary amount of time figuring out how to make sure we could test everyone appropriately, and every change that came with testing, they pivoted.
So it's really a testament to the partnership with really the community and a lot of the employees who have worked on the asphalt. So it's not easy, but you're there for the patient.
We were in charge of logistics, we were in charge of authoring those workflows, but it was the staff on the front line that made it happen. I mean, we were in the tents coordinating it, but it's another thing entirely to watch the staff do it and not hesitate to put on that PPE and be in those tents day one, having no idea what that was, and then continue to do that through the entire life of that collection site. I mean, that still touches me. It's amazing.
I just find them so inspirational, and I'm so proud of them. I think they don't necessarily look at it that way. They may say they're tired or they've had a hard day, but they never really say, why do I have to do this? And I think that's why they're so very, very special.